If your rescue cat wakes up with watery eyes, crust in the corners, sneezing, or one eye that keeps looking wet again and again, feline herpes could be part of the story. Hi friends, I'm Dr. Thomas Lee, and today I want to explain why cat herpes can cause weepy eyes, eye discharge, redness, and flare-ups that often return during periods of stress. Please don't panic, but please don't ignore eye symptoms either. Your cat did not choose this, and you did not fail them. Comment, weepy eyes, if your cat gets watery eyes more than once. Now let's separate comfort care from danger. When a cat keeps getting watery eyes, many owners think it must be dust, allergies, or something stuck in the eye. Sometimes it is. But in my clinic, when I see a rescue cat with repeat eye discharge, sneezing, crusty lids, and flare-ups that come and go, feline herpes virus is always on the list. This virus is very common in cats, especially cats that came from shelters, rescues, crowded homes, or stressful early life. Many cats are exposed when they are young. After that, the virus can stay quiet in the body. Then one day stress wakes it up. That stress might be moving house, a new cat, boarding, surgery, illness, a dirty litter area, poor sleep, or even a loud change in routine. The owner sees the eye first, but the trigger may be deeper than the eye. And this is where many loving cat parents feel guilty. They wipe the eye every morning. They buy another eye cleaner. They wonder if they waited too long. They may even feel embarrassed because the cat looks sick again. Please hear me clearly. If your cat has feline herpes, this is not because you are a bad owner. This is a virus that can flare. The goal is not to shame you. The goal is to understand the pattern. A mild flare may look like clear, watery discharge, light crusting, mild redness, sneezing, or a cat who seems a little less comfortable. Some cats keep eating and acting normal. Others hide, rub the face, or seem tired. But here's the mistake I want you to avoid. Do not treat every weepy eye like a simple dirt problem. Cat eyes are delicate. A red, painful, cloudy, or squinting eye can become serious quickly. Also, do not put random human eye drops, apple cider vinegar, essential oils, garlic mixtures, colloidal silver, or leftover antibiotics in your cat's eyes. Cats are not small dogs. Their eyes and bodies react differently. The first practical insight is simple. Look for the pattern. Is it one eye or both? Clear water or thick mucus, sneezing too, stress recently, eating normally, squinting or holding the eye closed? That pattern tells you whether this may be a mild flare you monitor closely or a warning sign that needs veterinary help. And the pattern matters more than one wet morning, because the next clue is how your cat behaves. Before we go further, look at your cat today, not just the eye. Is your cat eating, drinking, grooming, and moving normally? Or are they hiding, squinting, breathing loudly, or refusing food? That difference changes everything. If you want calm, safe cat care explained by a veterinarian, subscribe to Dr. Thomas Lee. I'll keep these videos practical, careful, and focused on what helps without putting your cat at risk. Now let's talk about what a feline herpes flare can look like. The most common signs many owners notice are watery eyes, eye mucus, red conjunctiva, crust around the lids, sneezing, nasal discharge, and that cold-like look. Some cats have one eye that always seems to act up first. In rescue cats, this can be heartbreaking because the owner thinks, I just gave this cat a safe home. Why are they sick again? But sometimes safety is not the problem. The virus was already there. A new environment can still be stressful, even when it is loving. So what can you safely do at home while watching closely? First, keep the face clean. Use a soft, clean cloth or cotton pad dampened with warm water. Gently wipe around the eye, not inside the eye. Do not scrub. Do not force crust off. Soften it slowly. Second, support hydration. Cats with stuffy noses may eat less because they cannot smell food well. Offer fresh water, clean bowls, and ask your vet whether warmed, wet food is appropriate for your cat. Warm food can smell stronger, which may encourage eating. Third, reduce stress. Keep your cat's routine quiet and steady. Give hiding spaces, clean litter, separate food areas in multi-cat homes, and avoid sudden changes when possible. Fourth, improve air comfort. Dry air can make nasal and eye irritation feel worse. A safe, humid room or sitting near steam from a shower room, not inside hot steam, may help some congested cats breathe easier. Keep it gentle and supervised, but these steps are comfort support. They are not a cure. They do not kill the virus. They do not replace medication when the eye is painful or infected. And this is the turning point. A watery eye can look small, but the danger signs are not small at all. Before you wait one more day, you need to know which eye symptoms are urgent. Here is the most important part of this video. With feline herpes, the question is not only, is the eye watery? The real question is the eye painful, damaged, infected, or affecting the whole cat? A cat with mild watery discharge may blink normally, eat normally, and act mostly like themselves. That can often be watched closely while you keep the face clean and reduce stress. But a cat with eye pain may squint, Hold the eye closed, rub the face, hide from light, paw at the eye, or become grumpy when touched. Squinting is not just cute blinking. Squinting can mean pain. A cloudy eye is another warning. If the clear front surface of the eye looks hazy, blue, white, dented, or uneven, do not treat that at home. Herpes can be linked with corneal ulcers, and ulcers need veterinary care because the cornea is fragile. Yellow or green discharge is also more concerning than clear tears. Thick-colored mucus can suggest secondary infection or more serious inflammation. Bad smell, swelling around the eye, or eyelids stuck shut should not be ignored. Kittens need extra caution. A kitten with eye discharge can go downhill faster than an adult cat. Blind cats, elderly cats, immune-weakened cats, and cats with other medical problems also need quicker help. Now let's make the safety line very clear. Do not put anything in your cat's eyes unless your veterinarian prescribed it for that cat. Not human redness drops, not steroid drops from an old bottle, not dog medication, not herbal drops, not oils, not vinegar. Some eye medicines can make certain eye problems worse, especially if an ulcer is present. That is why a vet may stain the eye, check the cornea, and decide whether the cat needs antibiotic eye medication, antiviral medication, pain support, or other treatment. This is also why random antibiotics are not the answer. Feline herpes is viral, but secondary bacteria can join the problem. The treatment depends on what the vet sees. The best home routine is not dramatic. It is gentle and consistent. Clean around the eye. Keep stress low. Encourage eating. Keep the nose comfortable. Watch breathing. Track discharge color. Separate sick cats from vulnerable cats when advised. Wash hands after handling eye discharge. That may sound simple, but simple is often what protects cats. The biggest mistake is trying a strong home remedy in a delicate eye. The safer choice is calm support outside the eye and quick vet care when pain signs appear. And once you understand that, the goal changes completely. You are not trying to cure feline herpes in your kitchen. You are trying to lower flare-up pressure before the eye becomes a bigger problem. So let's put this into a clear cat owner plan. If your cat has mild weepy eyes but is eating, breathing normally, not squinting, and acting mostly like themselves, start with observation and gentle support. Wipe around the eye with warm water on a clean, soft cloth. Keep the home calm. Make food smell inviting. Keep water fresh. Reduce dust, smoke, strong fragrances, and sudden stress. Write down what you see. Date of flare-up. One eye or both eyes, clear tears or mucus, sneezing or no sneezing, stress event or no stress, appetite normal or low. This little record can help your veterinarian see the pattern. If flare-ups keep returning, ask your vet about feline herpes management. Some cats need prescribed eye medication. Some recurrent cases may need antiviral support. Some cats have other problems mixed in, like bacterial infection, allergies, injury, blocked tear ducts, or other eye disease. The label herpes should not stop a proper exam. This is not about replacing your vet. This is about knowing when home care is comfort support and when medical care protects the eye. Call a vet urgently if your cat has severe redness, squinting, eye pain, cloudy eye, yellow or green discharge, swelling, bleeding, an eye held shut, a possible scratch, not eating, fever, weakness, breathing trouble, severe sneezing, dehydration, neurological signs, or if the cat is a kitten. Also call quickly if your cat is blind, elderly, pregnant, immune compromised, or already has a medical condition. These cats have less room for waiting. Now here is the hopeful part. Many cats with feline herpes still live loving, happy, comfortable lives. They may have flare-ups, but with lower stress, early care, clean routines, and veterinary guidance when needed, many owners learn how to spot trouble early. Your job is not to panic every time one tear appears. Your job is to notice the pattern, protect the eye, avoid unsafe drops, and act fast when the signs change. And if you rescued your cat, please remember this. You may not have caused the virus, but you can absolutely be part of their comfort. A quiet home, gentle hands, clean care, and the right vet help can make a huge difference. The next time you see watery eyes, don't just wipe and forget. Ask, is my cat comfortable eating, breathing, and blinking normally? That question can protect the eye before a small flare becomes a serious problem. Cat herpes can be common, but eye pain is never something to guess about. If your cat has weepy eyes, watch the pattern, keep care gentle, and call your vet for warning signs. Comment your cat's main sign, watery eyes, sneezing, crust, redness, or squinting. I'll read them carefully.